And I want to thank you for coming out to our weekly press avail briefing from the city on COVID-19 and how the city is continuing to tackle the novel coronavirus. So I want to thank all press in attendance for today. Today I'm joined by a number of representatives of the COVID-19 relief effort, including Dr. Avula, and I'd like to bring you up to date on some of the latest in terms of the city of Richmond. First, as a reminder, the offices of the City of Richmond will remain closed through May 17th. Essential employees are still reporting to ensure services are delivered to our residents. And obviously, to learn more about our efforts during COVID-19 and the pandemic, please go to richmondgov.com/COVID-19. There you can find real-time updates to how the city is still delivering services and any future plans moving forward. As of this morning, the Richmond City Health District is reporting 473 positive cases in the city of Richmond. There have been 12 positive cases in the city of Richmond's workforce, and 17 residents here in our great city have lost their lives due to COVID-19. Right now, I ask that we take a moment of silence in memoriam to those who have lost their life to this deadly disease. Thank you. With our continued efforts, alongside our partner with the Richmond City Health District, you will continue to see more testing in neighborhoods throughout the Central Virginia, Greater Richmond region. In the upcoming week, Monday, the Richmond Health District will be at the community supermarket in the East End for testing. On Tuesday, they will be at Southwood Apartment Complex in Southside Richmond. And on Thursday, they will be in Henrico County at the Eastern Henrico Rec Center, which will also be open to city residents to stop in as well. As we stated in weeks past, if you are under-resourced or uninsured, this testing is free. Also, for those who are experiencing symptoms that are maybe related to COVID-19, we continue to urge and encourage you to show up at these free testing sites. As has been stated in the past, we've seen a disparity in the numbers. We know that our communities are Black and brown, African American and Latino communities have made up a disproportionate amount of positive cases, and also those who have died because of this disease. And we are urging all communities, but especially those communities, if you have any of those symptoms, please show up and to be tested. And if there are any folks who have any questions, the hotline to the Department of Health is still available to you. That is 804-205-3501. Now I will have Dr. Avula to come to the podium and provide some information on the current work they're doing at the Department of Health. Dr. Avula.
Thank you, Mayor Stoney, and nice to be with you all this afternoon. Just wanted to kind of give a quick hits on the things that we've been up to this past week. You heard from the governor yesterday about some of the metrics that we'll be looking at as a Commonwealth to continue this march towards a phased reopening around decreasing percent positivity, hospitalizations, bed capacity, particularly ventilator bed capacity, as well as increasing the supply of personal protective equipment, and then testing and contact tracing. So much of our work as a local health department has been invested in those last two, the testing and contact tracing functions. And I think that, as we head towards, May 15th, if that's indeed when we decide to, as a Commonwealth, to move into phase one, there will be a lot of requests for guidance from businesses, from nonprofits, from many partners about how do we do this safely. And we've already received a handful of those requests as a health department. We're helping to review some of those plans. And for reasons I don't fully understand, the CDC was on schedule to provide a bunch of very specific guidance for churches and summer camps and schools and other types of entities that will move towards opening in the months to come. but that has been delayed, as I understand today. So we will use our best expertise as a local health department, but much of the sort of high-level expertise that would come from the CDC, we may have a delay on to be able to apply that lens to the opening plans of some of our partners here locally. Here's what we've been doing with testing. Yesterday at Nottingham Green was our 6th community testing event. As the mayor mentioned, we've got 3 coming up next week. I want to express my gratitude to all of the host sites. It's a heavy lift, certainly for our staff and our volunteers who have come out, but it's also an act of generosity of the host sites, whether that's a housing community like RRHA or a neighborhood, a privately owned neighborhood like Nottingham Green or Southwood. But I really appreciate the partnership of those different communities in standing up these testing events and helping get the word out about these testing events. I also want to particularly thank the Richmond Fire Department, because as we prepare for our testing event in the East End next week, the fire department will be on the ground in communities handing out masks and hand sanitizer and information about the upcoming testing events. And so really appreciate their efforts to get the word out. And then you heard yesterday from the governor about the National Guard's presence throughout the Commonwealth, and that presence has been particularly felt in a very positive way here in the city of Richmond. The National Guard has been extraordinarily helpful to us as we have performed what we call point prevalence surveys, so mass testing in long-term care facilities. And then they were also helpful in the event we did in Henrico yesterday. They did the tent setup and breakdown in Nottingham Green. We would love to explore other ways that the National Guard could be helpful to us as we expect to continue doing community testing events over the next few weeks. And I think part of our conversation, an ongoing conversation with our communities, is helping them understand who the National Guard is, what role they play, and how they're coming along in service. We do want to be sensitive that there are communities across our city and county that may be a little bit hesitant or maybe concerned about the presence of folks showing up in military-style Jeeps or in fatigues. And so there's some work that we've got to do on the front end to help our communities understand who the National Guard is and what role they're playing, and to ensure that that's not a deterrent to people to come out for testing. But we've been very grateful for the presence of the National Guard, and we'll look for other opportunities to deploy them in our work. Contact tracing has also been a huge part of our focus. As I mentioned last week, we continue to build our capacity. This week alone, we've trained 70 new Medical Reserve Corps volunteers to do contact tracing, and they will start next week in actually doing that work alongside with our committed staff. The state continues to take steps forward in their plans to hire approximately 1,000 contact tracers across the Commonwealth. I do see that this volunteer pipeline for now may actually serve as a way to funnel people into paid work. Yesterday, one of the things I think the mayor has done a fantastic job is engaging representatives of some of our underrepresented communities and seeking their input about how do we message in these communities, how do we get the word out, how do we really impact behavior. And yesterday on one of those calls, a member of our African immigrant community made a really insightful statement about the importance of hearing from people who know and understand and are a part of your community. And I think that is particularly applicable to our work in contact tracing. And so my encouragement and plea to residents of our community across the city and the county is that as the state moves to start hiring individuals to aid in contact tracing, that those of you who are from different cultures or speak different languages are going to be particularly helpful in doing some of that effective investigative work. And so I really want to encourage you to come out and to be either through the volunteer pathway now or to be hired in those roles as contact tracers. And we should have more information on that in the next couple of weeks. And then the last, we've talked a lot over the last 7 weeks about long-term care facilities and the fact that they have been, in many ways, the focus of these outbreaks. That continues to be the case. Much of our work is supporting the staff and the residents of long-term care facilities. I've also gotten many inquiries from the public and from the media about case reporting, and I've shared that VDH's policy has been that we're not allowed to share that information without the permission of the facility. A few weeks ago, the Centers for Medicare and Medicaid at the federal level, CMS, issued a statement that they wanted to require all regulated facilities to share information about cases and deaths publicly. And so it's taken a couple of weeks to work out what those details will look like. I expect that the rulemaking at the federal level will be completed this Friday, and likely May 17th we should see public reporting on that information for nursing homes and assisted living nursing homes that are regulated by CMS. Okay, that's all I've got. Thanks.
Thank you, Dr. Avula, and thank you for your work. And as I stated before, Dr. Avula's remarks, we are still urging anyone, if you have any symptoms, to please show up at one of the testing sites next week, and I'll just go about repeating them one more time. It's Monday at the Community Supermarket in the East End. On Tuesday, they'll be at Southwood Apartments in South Richmond, and on Thursday at the Eastern Henrico Rec Center. We are begging, if you have any of those, and you have any symptoms, please attend. For you can, we can repeat. Monday, the Community Supermarket on the East End. Also, I want to just add some remarks to. We know that the governor has been talking about a phase reopening, and he stated that this phase reopening is a floor, not the ceiling. And I have stated many times from this podium and beyond that I believe any approach to reopening should be slow and steady. We should take a cautious approach to this. We all know eventually that our economy, our city, all these entities and institutions will reopen at some point. But we must stress it's about how we reopen. How we reopen. We've seen a number of images all across this country of people celebrating spring breaks out on beaches, people gathering and congregating in large fashions in parks. I'm stating in the city of Richmond, we will take a slow approach to reopening. That is the approach I think is prudent because of public health. Obviously, you always will have to weigh the economic recovery alongside public health, but I truly believe that the life is more valuable than the dollar. And I will also say that you cannot, I know folks want to return to their livelihoods, and obviously I want folks to be able to do the same. However, you cannot have a livelihood if you don't have a life. And we will put the lives of our employees and also the lives of other Richmonders, those who live in this community, first. Bottom line. I think one thing that is sometimes goes missing in government and the work that we do here locally, particularly in a time like this, in a crisis like this, is the number of compassionate and generous citizens throughout this city. We would not be here today, roughly 8 weeks within the pandemic, without the work and help of a number of folks who are doing more than just providing charity, but they're also providing true acts of kindness. That comes down to being compassionate. And this week, I have proclaimed that the city of Richmond will be a city of compassion. This is a model built all across this country, all across this world as well, and that simply means that compassion is more than kindness. It's more than charity. It's using your gifts and talents to lift up your neighbor, building a stronger community through service, particularly within a time of crisis. In the city, we are going to center compassion in everything that we do. We've always done so, whether it's transforming systems to serve individuals who are in need, and also empowering those individuals through whether restorative justice and through equity. I want you to join me and my team and the Human Services Cabinet, led by Reggie Gordon, who's the Deputy Chief Administrative Officer for Human Services. And please use our website, rvastrong.org, the way to continue to exhibit your compassion for your fellow neighbor in this community. There at rvastrong.org, you will find a compassionate connector, and there you can pledge to prioritize compassion in acts, big and small, whether it's the giving wall, whether it's the Robbins Foundation work or even helping those who are in need of just some of the simplest things, like that over at the Giving Wall. I think all of us can galvanize behind that one principle of compassion. Today, I want to thank Molly Reinhardt of Befriend, the force behind the effort, and all the members of the Human Services team as well, Reggie, for their continuing work to connect others through compassion. Well, I'm very grateful for your work, but also grateful for the work of others who can't be physically in this room today, who are continuing to look out for those who are part of the underserved. And we all know that we are a stronger community when we look out for the least of these, particularly in this trying time. So thank you, Molly, and thank you, Reggie, as well. Thank you guys so much. And speaking of compassion, compassion also serves us in a time where we know that some of the basic essentials to living your life throughout a pandemic can be challenging. As I've stated in the past, a lot of folks have a plan B in a situation like this, particularly you're living paycheck to paycheck. But now if you're 8 weeks within this crisis, the plan A, the plan B, the plan C, the plan D, all out of the window. And that's why we have been grateful for a number of great organizations who have stepped up through this crisis. We have been monitoring the state of Richmond's food system throughout the pandemic of COVID-19. And today I'm joined by members of that team that help us monitor. It's Doug Pick from Feedmore and also Reggie Gordon, a part of the city of Richmond. This work includes subject matter experts on the food bank system, state and federal food policy, the restaurant community, and more. Today, I stand confident that our food access community in Richmond, of the work that they've done here in Richmond, and also that the status of the food system is secure. So the main purpose of this group is to cover any emerging gaps and bolster the structure and reach of an already robust apparatus within Central Virginia. We know that the food bank system is in good shape here locally, but we've also seen and heard a number of stories throughout this country, as far west as San Francisco and Las Vegas and parts of the Northeast as well, where there has been some challenging. Folks who've never thought they would have to depend on a food bank or a food pantry are now showing up in lines waiting for a meal. I also want to recognize the work of Richmond Public Schools as well on the distribution of food items on a daily basis, particularly getting them through the weekends. I hear the busiest day is preparing for Thursdays so they can get folks the amount of food necessary through the weekends as well. These individuals, these entities, alongside the work of Doug Pick at Feedmore, have been essential to our relief efforts locally. And today I wanted I wanted to make sure Doug said a couple words, but also I wanted to make sure that folks know that the federal government recently announced that Virginia has qualified for the pandemic EBT program. This program is meant to provide nutrition support to families throughout the city of Richmond, and all students who qualify for free and reduced lunch will benefit from the pandemic EBT program. Every family will receive roughly $370 per child through EBT. We're grateful for the helpful buffer. $370 over the coming 65 days will be meaningful to a lot of families who, as I've said, lost plan A, lost plan B, lost plan C, lost plan D. But there's more that we obviously can do, and we still need an expansion of SNAP benefits for our residents. And with many people who have never entered into this social safety net, never been unemployed, this is a whole new world for a number of people. And that expansion will help ensure that those individuals don't fall through the gap. So I wanted to ask Doug to come over and say a few remarks on your work thus far, what we've seen in the system, and what we can look forward to over the course of the next few months. All right, Doug?
Thank you, Mr. Mayor. Good afternoon. The state of the food system and the food assistance system in this city is very, very solid. We've had tremendous cooperation with the city officials. Reggie Gordon His team has been just wonderful to work with. He combines a number of us besides food insecurity on the human services front to make sure there's collaboration and synergies that really make us be all we can be. A lot of mitigation strategies were put in place early March for this event or this ongoing crisis. It's held up well. Volunteers dissipated quickly, and this community really stepped up. In the last month, we have acquired 1,225 new volunteers, if you can imagine. That's the heart of this city and of this community. Food banks work off an agency system. Feedmore covers 29 counties and 5 cities. Within that, there are 272 agencies who distribute our food. Some very large, such as Chesterfield Food Bank, one of our large agencies, some smaller. It's held up well. Other parts of the country, Mr. Mayor spoke to, have not. Hence, you've seen 10-mile car lines because their infrastructure didn't hold up. Not the case here. Of 272 agencies, we've only lost 28, 10%. In the city of Richmond, there are 85 agencies. We've only lost 11. We still have 74 agencies still distributing. We have mobile distributions. We are back in business and really tickled to work with our great partners at RRHA. That begins again on Monday. Make no mistake. We work through those issues and everyone is back on track there. The food supply is excellent. The government's providing a lot of food supply, the federal government. The mayor and the chief of staff, Lincoln, have always been very concerned about our retail system. How's it holding up? We know the supply chain got some bumps. When you 5X surge buying a food in grocery stores and a couple weeks later 3 times surge, the supply chain has a hard time keeping up. It was just the pipes. It's not the supply. Make no mistake, the protein situation is coming. It will get worse before it gets better. That's meat, that's chicken. In this city, we are very well stocked with chicken. We have a number of producers near us who've been so generous over the years. We have outside resources that will certainly carry us in that most important product over the next couple months, and that should be plenty of time for the system to correct itself and get back. So all this said, we're in great shape. But make no mistake, when the unemployment goes up 7.5% and say we're at, say, 13%, that meant in the state of Virginia an extra 440,000 people became food insecure. That meant in this beautiful, wonderful city of Richmond, 12,000 more people became food insecure. Let's suppose it goes to 20%, and odds are it could. Another 12,000 folks. We believe we're covered for the summer due to the largesse of the federal government, how it's helping. What we all need to be ready for is September, when the unemployment, some of that money is not there, and these folks still don't have jobs, and we are preparing right now to handle that next quintile of folks. The people we serve, the low-income folks, know us. They know our system. They know how to work with us. This next group, the folks that Mr. Mayor said never thought they'd be here, never thought they'd be at our doors. We'll be ready for them, and that's going to carry on from September through June, but we'll be ready. The city's ready, and the food system's ready. It's just an honor to work with you and be at this place where we are. We're in solid, solid shape. Thank you, Mr. Mayor.
Don't forget your mask.
Oh, well, that's right. Thank you. We'll do that.
You know, I think before we even declared a state of emergency, I called Doug just to feel him out about whether or not they were prepared, because I think we saw this coming, and he was ready to go from day one. And so thank you for continuing to be a partner here in the city, Doug, and we really are grateful for your work. We also are very grateful for the work of each and every person who's contributed during this difficult time. This week we have celebrated a number of our public employees, from the celebration of recognizing our firefighters, recognizing our nurses, recognizing our teachers. This is Teachers Appreciation Week. There are a number of public employees and public servants who wake up each and every day and they love the job that they do. Why? Because they are helping people. And there's no time like today to help folks. And those who are considered our helpers, those public employees who are showing up here in Richmond are still working, are at the healthcare system, driving our buses. They have not only my gratitude, but my 150% of my pure respect for the work that they do. Sometimes it can be done, you can say somewhat anonymously. But now more than ever, we're seeing that they are the glue that hold this community together. And I am thankful for the work they've done over the course of now, come Friday, 8 weeks. So with that, we'll take some questions.
Can you give us an update on the GRTC bus operations, just with workers in terms of COVID testing?
I don't have, do you have Danny, you have anything on COVID testing with? Livia, we can get you an update on that. We'll talk to Julia, we'll get you an update.
Do you think businesses are going to be ready to open next Friday or not, given the state of things?
You know, Mark, that's a tricky question to answer because I think this is about whether or not the patrons of these businesses have enough confidence to come walk through those doors. And from the people I've spoken to via text or virtually, if we do head towards a reopening, a lot of folks say that they would be hesitant to walk into a retail store or anything of the sort because of this disease. And I believe before we enter any phase of reopening, we have to have more robust testing. We have to see a drop in hospitalizations as well. We have to ensure that we have the capability and the capacity to follow through with contact tracing. I just don't know whether or not the confidence is there just yet. And that's why I continue to caution all of our leaders at every single level before we move into any sort of phase of reopening. As I stated before, we will reopen as an economy. We will reopen as a city. We will reopen as a country. However, it's all about how we do it. And our number one priority should be protecting the public health, but also giving those in the public realm the confidence to step back into a business without fear that they can potentially contract the disease and spread it to someone else. Go ahead, Mark.
If the state recommends a more liberal approach to reopening, are you prepared to break with that and offer a more conservative approach locally?
I never want to get out ahead of what the governor may or may not do. Obviously, we are going to review whatever order that comes down from the governor, whatever lifting that occurs. Once we review it, we will make a decision at that time. But as I've stated before, Mark, we're going to be cautious about this. I think that's where, I think that has to be our priority is public health. And so we want to get folks obviously back to work. We want folks to open their doors again, but we're not going to rush into this. This is not going to be a sprint. This work we have to do within the pandemic will be a marathon. And we are just at the beginning.
Cameron, and sort of following up on that, I know the governor has talked a lot about how the virus doesn't respect boundaries, and you all that declared the state of emergency locally with different localities. Is this something that you and Henrico, Gooch, Chesterfield are all going to make the same decisions in terms of whatever floor you want to build those restrictions at, or is it now just going to be city, county, make their decisions? And then for Dr. Avula, if I could you, how many contact tracers do we have in total? And as well, regarding the PPT testing by the Virginia National Guard, I know VGH says they've got a list of 100 long-term care facilities they want to tackle around the state. How many have been done in Richmond and Henrico, and how many are left scheduled for PPT?
Cam, you are 100% correct. This virus does not respect boundaries at all. And that's why roughly 8 weeks ago, we collectively as a region decided to declare a state of emergency. And as we move into reopening, we will obviously consult with our partners in the counties, in Henrico, Chesterfield, Goochland, Powhatan, you name it, as we move forward. But my number one priority is going to be Richmonders. Number one priority will be Richmonders, those who live in the city limits. Now, you know the difficulty about going at these sort of things alone, because not only does the virus doesn't respect boundaries, but as a community, we do things together, right? There are folks who live in Henrico who work in the city, or folks who live in the city who work in Henrico, and vice versa. People will be moving around, and so as I stated earlier, my request to all leaders at every level is to move about this in a very cautious way. Okay? Dr. Avula.
So, Cameron, the second question was the volume of point prevalence surveys that have been done in long-term care facilities. In Richmond, Henrico, 8 or 9 that we've done, and they're varying degrees. I mean, sometimes we go in and test every healthcare worker and every resident, and sometimes it's much more targeted based on, just epidemiologically what we're seeing in a particular community. But yeah, that number is either 8 or 9. We've got a few that we're continuing conversations with who, from the facility end, there's a certain degree of just needing to learn and some hesitancy that we've got to work through and help them understand the value of doing widespread testing at this point. So I think, we've got about 70 nursing homes, assisted living facilities throughout Richmond and Henrico, and then a whole bunch of other facilities when you think about independent senior living that would also benefit from point prevalence surveys. To the question of contact tracing, so as a staff, we have somewhere around just under 20 individuals who have been really engaged in the follow-up work with positive cases. And then we are in the process of training, as I said, 70 Medical Reserve Corps volunteers this week who will start actually engaging the work with our staff next week. And I expect of the 1,000 or so contact tracers that the state will end up hiring, I would guess somewhere between 100 and 150 of those would be committed here in the central region, and we'll have to figure out, is that managed regionally, and are they apportioned out to the districts? We're still working through some of those details.
Ben? Just as a follow-up, I know you touched on a number of points regarding reopening in light of the governor's May 15th date. Are you considering any specific restrictions at this time, and what are they?
Now, as I said it to, I guess it was Mark's question, or maybe it was Cam's question, we want to see what the governor says first. Once we see his order or what he has in mind, we will react, we will respond. Here's what I don't want to see. I don't want to see, I don't think we're ready for bowling alleys to be open yet. I don't think folks are ready to crowd into areas. I don't see mass gatherings happening again. This has to be slow. And we saw some lifting earlier last week, I guess, with medical offices, with dentists, dental offices, and elective surgeries being commencing once again. But for me, it has to be, I just don't foresee mass gatherings occurring anytime soon. And I would avoid. I think I stated already, we should be crowding around, in beaches and things of that nature. I just, I disagree with that sort of approach. I've not necessarily been 100% on board with what I've seen out of Georgia and places like that. I think that's been here's the thing. The data has to dictate the approach, right? We've laid out criteria on how we go about reopening, rephasing in this reopening, and let the data dictate, the evidence dictate where we have to go. I know folks want to have these gut feelings at this moment, but this has to be more than just about a gut feeling. Why? Because there's lives on the line here, right? I think we all, as a community, should value any life that is lost during this moment. And if we can play a role in avoiding that loss of life, shouldn't we do so? Shouldn't we do so? If that means us being cautious, then I am committed to doing that.
As a follow-up to city revenues, with that in mind, considering city council moves forward with this latest proposal from the developers who brought forth Navy Hill, do you favor this proposal as it is? And, would you prioritize bringing in, minority investors in a similar approach you did with the previous proposal? Do you like the current proposal?
Yeah, I have not personally reviewed the proposal yet. I believe we received it, maybe early May. May 1 or May 2 or something of the sort. So I've not reviewed it myself. I've had the team review it. We're going to adhere to the policy, to the guidelines that have been laid out through state code, and that means this will be has been forwarded to the city council. There will likely be a competitive portion of this as well, because this is an unsolicited bid.
Do you know when you will review it?
And I've not set a timeline for the city council, for my team yet. They'll obviously have something ready for me in quick fashion. Once we have that, we'll obviously let the city council do their part as well. There's already, as you know, a small area plan underway for the parcels just north of us. At the end of the day, we are certainly heading into a recession. That is certainly about to happen. And I firmly believe that underutilized land that the city owns could be potentially used as a stimulus to our economy. But it has to be done in a proper way, adhering to the city's code, and we want to make sure city council plays a role as well.
Dr. Avula, just a couple of things for you. Could you give a little bit of an update on the community testing numbers? And also, I know you had said that you haven't received any guidance for businesses, restaurants. Say that we don't get that guidance, or you don't get that guidance or recommendations. What do you say to businesses as they prepare to open?
So the second question, if we don't have clear guidance from the CDC on the reopening of businesses and camps and other things, what do we say? We use what we know about the transmission of disease, right? So any circumstance where you really can't keep a 6-foot distance, or anything that maybe puts people at risk because of extended periods of time indoors where the virus could be aerosolizing. I mean, we'll use the lens that we do know, which is how the disease, for the most part, is transmitted, and then apply that good judgment to the plans that we're seeing. I mean, that's what we've been doing over the last, both in the phase up into this, as everybody's been trying to figure out what to do. And so we do have a lot of information. We just won't have the very explicit guidance that we can point to, hey, here's what the CDC guidance is. So, and I expect that eventually it will come, but the fact that, we're on the verge of considering some form of reopening, many states have already moved in that direction, we need that sooner than later. Sorry, what was the first question?
What was about the numbers for community?
Yeah. Okay, so I'll just give the numbers tested at the 5 or 6 community events so far. And sorry, I'm doing this off the top of my head. The first one at Woodman West was 22 individuals. The next one at Southwood was 69. Hillside 42. Creighton 115. Gilpin 91. And I think we did 101 or 102 at Nottingham Green yesterday. And so still haven't gotten all the results from Nottingham Green. We do have results from most of the other testing events. As I shared last week, because we started to open up the testing events to residents outside of those communities, we had a lot of people. So for example, in our 3 public housing events, more than 50% of the people who came to those events actually lived 2 miles away or further. And so it's not necessarily a great representation of what the disease prevalence is in that particular community. So what I've had my team do is actually look at case rates by population for every census tract in the city and the county. And there's a huge range, a lot of the case ranges are somewhere around 60 to 150 cases per 100,000 population. So that's just the sort of consistent denominator we use. So 60 to 150 makes up most of the city and county. And then there are some areas where you have 1,000 or greater, and largely those correlate to where we've had significant outbreaks in long-term care facilities. So when you look at this map, the hot spots are places in the county that have long-term care facilities, and then a few neighborhoods along the south side of Richmond, kind of bordering Chesterfield. So we have a couple final tweaks on those maps, but I should be able to send those out this evening, probably, so that people can actually look at what that distribution looks like. Mm-hmm.
Couple more questions, Mark and then Cam. You good, Mark? Cam?
I was going to say, Dr. Avula, regarding, you said you've already gotten some requests of help from businesses and nonprofits. What are the big things that they're asking you, expressing for you as we move into the reopening phase?
Yeah, I mean, I think every unique circumstance, they're looking at how do we do this. So if we're trying to open a summer camp, what kind of activities can we engage in? How much do we have to do outside versus inside? If we are doing inside activities, do we have to limit the number of people? What's the right ratio? So I think it's a lot of the specifics of each of those circumstances that are saying, does this comply with the public health guidance? And so for us, it's not rocket science, because we do have like the sweeping understanding of how the disease is transmitted, but there is some contextualization that has to happen. And so even as we think as local government about opening up, do we have all of the employees come back at one time, or do we do staggered shifts? I mean, it's things like that each organization or nonprofit is trying to work out the details on, and a lot of that is looking to public health for some guidance.
Thanks a lot, guys.
All right, guys. Thank you guys so much. Once again, thank you for always showing up and continue to do your jobs throughout this crisis as well. You guys are truly essential to getting the word out and the information and facts to the people who need it the most. So I'm grateful to the media and the press for what you've done over the course of the last 8 weeks. Once again, stay safe and stay strong. Thank you.